Yeah, what about managing the side effects of CAR T? That improving?
It is. I think just the fact that we are now seeing less of the neurotoxicity that we were seeing in the initial, patients that were getting CAR T, and the serious neurotoxicity like the Parkinsonianism, where patients, couldn't walk or hold things because of the tremors they were having that were so significant. And then something kind of like Guillain-Barré, where people are getting ascending paralysis. And so, again, those are very serious things that we don't want any of our patients to get. And again, most of it was with cilta-cel in their CARTITUDE-1 study. There is, black box warning with ide-cel too that can happen. We just don't see it at the same rate. And again, when patients got better bridging going into CAR T, that rate dropped from 6% to 0.5%. So it really is a huge difference by just giving better bridging and having myeloma controlled better going in. We are seeing some other side effects that we didn't necessarily see on the original clinical trials, like facial palsies. These are things where, patients can't talk very well anymore, or, their side of their face is drooping. And those are reversible, thankfully, for the most part with, steroids, things like that. So we watch for that. There's some other, side effects. Again, these are immune cells going into your body. So anything can happen. So we definitely have keep a close eye on all our patients. But for the most part, especially things like infections and this neurotoxicity, we've learned that, again, the less myeloma going in, the better patients do, and the faster they recover. So for the most part, patients now are doing much, much better than, when patients were originally on those trials where we didn't know what was going to happen. And I think the infection piece is such a big deal that, our patients definitely need supportive care. So even though this is a one and done where you get, your chemo, you get your CAR Ts, and then you're not on any myeloma therapy, you are on, supportive therapies, right? So things like IVIG for your immune system, things to protect you against something called PJP pneumonia for at least 6 months, if not longer. You're still on anti-shingles medication. So it's not that you stop all medicines, but it's you stop the myeloma medicines. And then at least for the first 6 months, maybe even up to a year, we have to make sure you don't get any major infections.